This is easily one of the most commonly misdiagnosed injuries that we will see in physio. This may be happening to you already. You've been to see a GP, you've explained it to a friend, you've looked it up on the internet, and you're beginning to think, or that you've been told, that you're going to need a hip joint replacement. That's not the case. Majority of the times, 99 times out of 100, when we see these injuries, people fear that they're going to need a hip joint replacement, or they've got a hip problem, which is a little bit more difficult to sort out. That actually turns out to be a sacroiliac joint problem, and that is a joint that's between your hip and your back and gives very similar problems. So on this video, we look at exactly what a SIJ problem is, why you're in the pain that you're in, and importantly what you're going to have to do to get your problem settled. Before I do that, I'll just introduce you to myself. My name is Paul Goff. I'm one of the UK's leading physios. I write columns for the Northern Echo, for the Hartlepool Mail, so I'm constantly writing about back problems. I'm researching back problems, treating back problems, speaking at conferences about back problems. So to me, these things are very familiar, and I'll do my best to explain what you're going through and what you're going to need to do to get this problem settled. But first, I'm going to give you the chance to access free exercises from me. For me, with back problems more than any other injury, the number one thing that you need to do to stop this thing from happening again and to prevent this pain from coming back, you have to get these muscles stronger. And what that means is you need to be doing exercises, and we're going to give you these exercises. When you've finished watching this video, have a quick look on the web page, enter your name, your email address, hit send. You will get within seconds in your email account 3 of the most powerful exercises that I could possibly give you to help reduce this back pain and stop this from being a lifelong problem. These would be the type of exercises, you can see on the image there, that if you booked an appointment with us, this would be the first level of exercises that we would give you. So we're going to give you these now. After you've watched this video, just have a quick look for that Start Your Recovery Now headline, put your details in, and you will have these exercises pretty quickly. So the real problem is it really does get diagnosed as a hip joint problem lots of times, and it happens because it's so close to the hip and the symptoms are very similar. The SIJ, the sacroiliac joint, is a joint that happens to be in between your sacrum, which is your back, and your ilium, which is your hip. So lots of people get it misdiagnosed, and if you do nothing else to come and see a physio, often the relief that people get when they realize that they don't need a hip joint replacement and it isn't a hip problem that's going to cause lots and lots of problems down the line, is worth it. So how would you know if you had it? That's a picture of my wife on the beach. No, it's not. I'm only joking. That's the best way that I can get you to understand where the hip joint is. It's one of those dimples at the bottom of your back, and a way for you to determine whether or not you've got this problem, simply put your hand around the back and touch one of those dimples in your back. And if you're getting pain in there when you touch it, that's likely that you've got a sacroiliac joint problem. You're likely to be aged between 40 and 60. Pain has happened because of a sudden twist or turn. So you felt this pain come on very quickly, very sharply, and it's now exactly where that arrow is that you're starting to get your pain, but it also goes down into your hip area as well. So don't be confused, there's still a SIJ problem if you're getting pain around your lower back in your hip area. And one more thing with this, pain is not just the only thing. You can get lots of stiffness. People come in and say that their back is really stiff, they struggle getting out of a car, and ultimately on a morning struggling putting socks and shoes on is the big giveaway, and is often the first thing that when a person tells us this, we start thinking about a sacroiliac joint problem. So what is it? Well, it's basically just between a joint between your hip and your back, and if you have a quick look there, on the right on the image is your back, it's your sacrum sort of area, and on your left is your pelvis, that's your pelvic bone, and in between the two is a joint. Now that there, you can see on the image, it says abnormal function, and that means that there's too much space. So this joint has been pulled apart because of this lift, this twist, this whatever you've done, and as it's happened, this now is locked into place. So it's gone too far too fast, and then it's locked back into place, so the ligaments and the muscles have snapped back together and causing the pain and the stiffness that you're now suffering. It does it because muscles tighten, joints lock. What they want to do is they want to protect the discs and the nerve. If your sacroiliac joint is really stiff and tight, it stops you from moving, from doing things, from lifting, from twisting. And that's not nice, but it is a good thing because in the long run it stops these discs and these nerves from being damaged. And if these things get damaged, you're going to be in 10 times as much pain as you are right now. So as much as it's a bad thing to suffer the pain, it's actually a good thing to help you. It gives you a bit of time. It buys you some time to get this thing sorted before other problems start happening. How can we help? So how can physio help? You'd need hands-on treatment. You're going to need massage, you'd need manipulation and mobilization, and that just means that we're going to loosen the muscles, we're going to get the joint back into place. We'll give you an explanation that is specific to you. It's tailored to your needs. It's not going to be some generic fact sheet or something that somebody's posted out to you that might be of interest to you. This explanation that we will give you about your sacroiliac joint problem will be specific to you and your life, your posture, your sport that you play, your work, the way you sit. it'll be tailored around that and exercises that you can do at home. You can, like I've said earlier, you can access the exercises as soon as you've watched this video. Get these exercises and get started with it. So when you do come in to see us, you're already one step ahead of the game. So to sum this injury up, you will need 3 to 4 sessions of physio. It takes about 3 to 4 weeks, but you will start to get your relief after every session. You'll feel a little bit easier, a little bit looser, and this thing will get better as treatment sort of carries on. You'll need deep massage, stretches, and exercises. So wherever you're watching this, you're in Darlington, Durham, Gisborough, Hartlepool, we have clinics there. We will always offer you this. Get your session free if physio can't help. And what that means is if we can't give you the hands-on treatment, we can't give you exercises or advice, or we can't give you a diagnosis to take to let's say a surgeon or somebody else that you might need to see, very unlikely in this case, but you would never pay for your treatment with us. And to get your session, to get your physio booked, you can just simply call 0800 043 8671, and you can actually use that number as well if you wanted to speak to a physio to ask more questions, or you want some more exercises, or you just want some more advice. Please feel free to use it and give us a call. And just before I go, one final thing, I'll let you have a quick look inside one of our clinics. That's inside the Gisborough Clinic. That is our staff. When you come here, you will meet some of the most friendly, fun, active, outdoorsy sort of people that you'll ever meet, and we love to do yoga and Pilates and things like that, and that's an in-house yoga class that we do every Wednesday morning that our staff take part in. And the final image there is of inside the Hartlepool Clinic. So there's lovely waiting rooms and lovely staff waiting for you when you do call and when you do eventually come in and see us. So to get your session booked, 0800 043 8671 is the number you need. Please give us a call. We look forward to hearing from you. That's it from me. Take care. Thanks for watching. I'll speak to you soon.